Hi, Carmen Bunde with Berkshire Hathaway HomeServices, Ambassador Real Estate, and I'm here today with Andrea Booz of A&B Insurance Solutions, and we're going to talk a little bit about what she does and how some elements of her work can actually impact what your budget is if you are moving into assisted living. So thank you for being here today, Andrea.
Thanks for having me.
Yes, so tell us about Insurance Solutions. What all does that cover?
Okay, so mostly what I handle is Medicare, health insurance. I do help people on the health insurance marketplace, as well as group for businesses, and so pretty much anything on that line. I do life, long-term care, disability, but primary focus is Medicare and health insurance.
Okay, and when you say the marketplace, you're specifically referring to?
Obamacare, otherwise known as Obamacare, yes. And there's never a fee to work with me, so I can shop the plans and help people select the plans that are right for them based on budget, networks, and things of that nature.
Okay, so isn't there a particular season for that?
There is, and that one for the health insurance marketplace starts on November 1st and runs until December 15th for a January 1st effective date. However, they did extend it so that the period actually runs until January 15th of next year. Anything written after December 16th will be a February 1st effective date.
Okay, and why did they do that? Do you know?
To get more people to sign up.
To help extend for people to get signed up.
Yes.
People don't always realize the timelines.
Right. Yes. Yeah.
Okay.
Yeah.
So we were talking earlier about how does insurance impact for some people who are selling their home and moving into assisted living, and you had a great example of how what you do can dramatically impact what they have left available on an annual basis. So tell us a little bit about that story.
Okay, so I think a lot of people don't really realize that when they move into assisted living, they are afforded a special enrollment period. And what that means is at that time, someone can take a look at their drug cost, whether that be on a Medicare Advantage or a standalone prescription drug plan. The reason that it's very important is because when you move into assisted living, most often they will require that you use their long-term care pharmacy, whoever they are contracted with.
So you don't necessarily get to stay with Hy-Vee or
Correct.
Walgreens or whoever.
Correct, even if they have delivery. And the reason for that a lot of times is because they will pill pack. So it makes it easier for the facility. And in our area, most of them seem to be a pharmacy out of Troy, Ohio, and then one here in Gretna, Nebraska.
Okay.
So that can definitely change how much they're paying. Last year, I met with someone who moved into assisted living and didn't realize that she should change her plan. And after I ran her prescriptions, and it was during the annual enrollment period, which is right now, it started October 15th and it goes till December 7th. We looked at her plan and found that the current plan she was on did not play nice with the long-term care pharmacy. So I was able to find her a plan that had all of her physicians in network and met all of her needs and saved her $31,000 on her prescriptions.
Oh my land, that is huge.
Yeah.
Huge. Yeah. So you found that during this regular enrollment period, which is the fall for all of them pretty much. But yet she might have moved in April and could have saved almost 6 months worth, $15,000.
Yes, she was paying too much because she didn't realize, and none of the family members or anyone that was helping her realized either that she had this special enrollment period.
Oh my gosh. So that is huge. That's a great resource. So what I'm going to keep in mind, and what I want realtors and anybody who has parents or those who are looking at selling their home and going into assisted living, we all need to keep in mind that we have a special window, a limited window. We need to schedule an appointment with you to review everything and see what will work for the most affordable plan for the insurance and prescriptions.
Correct. And the way I work it is if the current plan that they're on is the most suitable plan, I let them know that. I don't change just to change.
Great.
I make sure that it is a necessary change and show them all their options.
That is perfect. That's what I love to hear. Thank you for that, Andrea. I really appreciate you taking the time.
Yeah, thanks for having me.
Of course. And if you have any other questions, be sure to call Carmen first.